Welcome, everyone. I think we have a few other folks joining and some folks getting connected, but we are going to get started today. Thank you all for joining us. Thank you for committee and our guest presenter today. We're very excited. So my name is Kim Barnes, and I'm the Director of Student Affairs for the Phoenix campus, College of Public Health. Thank you so much for joining us for the Summer 2023 Virtual MPH Applied Practice Experience Conference Live Student Highlight event. We're so excited to have you with us today. We have today joining us, we have current students, faculty, preceptors, and continuing students. We'd like to take a moment to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnership, and community service. So again, thank you all for joining us today. So as you all may know, our Master of Public Health students come from Tucson campus, Phoenix campus, online campus, and a global campus program. And they do all conduct applied practice experiences, colloquially referred to as internships. So if you hear me say internship, you hear me say applied practice experience, or even APE, those are all the same thing. I'm going to try to use internship for consistency today, just to avoid confusing folks. This experience serves as an integral part of the MPH degree curriculum, in which our students are able to utilize their academic knowledge from the classroom in real-world practical situations among professionals in the public health workforce. These hands-on experiences benefit students and organizations alike. We are so grateful for the collaborations between our students, faculty, and super importantly, our agency preceptors. We're very proud of the contributions of our students that they make to the field of public health. This virtual celebration is an opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. So coming up, you're going to meet one of our students, Isabel Fangman, and learn more about her experience. After our discussion with Isabel, we'll provide some additional details about the conference and how to view our fantastic student presentation. So without further ado, allow me to introduce you to our featured student today, Isabel Fangman. I'm going to introduce her by way of her brief bio, and then following that introduction, I'm going to start with some prepared questions. Please, if you have questions as we're chatting, you can raise your hand, and that's a great way for us to keep track of who's next for the question. You can also use the chat function. So if you don't want to speak or unmute, that's fine. You may have camera on, camera off. Today is really meant to be a celebratory discussion, so we're hoping to invite everyone to join in. So I'll have some prepared questions, entertain questions from the audience, and then at the end, we'll make sure we open it up to everyone else for any final questions. So Isabel is a second-year Master of Public Health student in the Family and Child Health concentration with a track in maternal and child health, and at the MESCOP Tucson campus. Before coming to the University of Arizona, she earned her BS in chemistry at Converse College, now known as Converse University, in Spartanburg, South Carolina. During her MPH program at U of A, she worked for the UAHS, so University of Arizona Health Sciences Asthma and Airway Disease Research Center, as a graduate research assistant for the Binational Early Asthma and Microbiome Study. Her research interests focus on health disparities faced by women and girls involved in the criminal justice system. She hopes to pursue a career developing and improving programs and policies aimed at strengthening the health of justice-involved women, girls, and their families. And she's anticipated and planning and almost ready to graduate in August 2023. So pre-congratulations, we're so excited for you and your next adventure. So our first question is, can you briefly describe your internship experience to us?
Thank you so much for the introduction, Kim. Hi, everybody. Like she says, my name is Isabel Fangman. And for my internship, I studied maternal and child health issues in correctional settings. So my internship took place at NAU with Dr. Ricky Camplain as my preceptor and Dr. Kelly Palmer as my internship chair. And through this internship, I wrote a grant proposal studying prenatal care in Arizona prisons. I wrote a policy brief geared towards NAU students who are interested in the field of correctional health. And I made a resource list for students who are interested in correctional health as well to kind of supplement the policy brief. think that's all I have to really say about it. We can go more in depth for sure.
Yes, our questions will definitely lead us on an adventure today. Super interesting and really great deliverables. So for those in the space today who maybe don't know about our internship experience, students are required to produce at least 2 deliverables for their agency. And grant writing, what a great one to get some practice and skill sets in for sure. And then the policy brief and interest statements. I love the idea that you were bringing in student interest and encouraging sort of that next level of involvement for students in that experience. So that's great. So how did you find your internship experience?
I'd been working with Dr. Camplain for about a year before my internship began. Been really interested in correctional health and kind of studying pregnancy outcomes in prisons because it's really not researched. So I talked to my roommate. Her name is Callie Curley. She's a doctor of public health student here at U of A. And she was saying, hey, you need to get in touch with Ricky. You know, I worked with her during my master's at NAU. You know, she does correctional health research. And I emailed her and another colleague of mine, Sabrina, who we had also connected. She's another doctor of public health student. And we just started talking with Ricky, and it kind of became this mentoring relationship over that year. And then eventually I asked her, hey, I need to do my internship. This is what I want to do. Are you willing to help me? And we ended up just developing some deliverables and kind of figuring out what would benefit NAU, what are some of my goals as well. And here I am.
I almost forgot to unmute. So what I love about how you describe this is there's elements of networking with fellow students and then developing a networking mentor relationship and then bridging that into the experience and then sort of having that negotiation with the site about what you're going to do. And I think this is an often under talked about way of getting an internship. Like you talk to fellow students and then help to make that connection, which I think is a fantastic way to feel a little bit more comfortable as that relationship develops. Like this is going to work. This is going to be a good experience for me. Not that there isn't value in all the other ways students find internships, but I really like that you did some networking with the DRPH students. We don't often hear that. And I think they're a really great resource. They know lots of things and they're well invested in the community. So that's excellent to hear. Shout out to those DRPH students for helping you develop that relationship. That's great.
Yeah, no, they're awesome. They're both a force to be reckoned with. So
even better, even better. So can you describe to us any really what you would consider or what you felt like were really unique aspects or elements of your internship?
Definitely the mentorship. I think being able to engage with a mentor was the most unique part and the most special part to me, because I feel like when you're a master's student, I feel like you really need a mentor. And really realized that halfway into my program where I was like, okay, I really need somebody to kind of help guide me through this, to be able to ask questions and to learn from their experience. There's a lot that I feel like I learned from both Ricky and my internship chair, Dr. Palmer. Like they both have so much experience and just saying, okay, these are your next steps. This is how you write a grant. This is different things you need to be considering through this process. You know, it was really important to me. And I think that was the best part.
There really is power in that relationship. We're happy our students have mentors, but sometimes one mentor isn't enough either. Sometimes you really want to sort of bridge out and find a mentor who is doing the work you want to do, which is often what we tell folks at all levels of career development. Find someone who does what you do and talk to them and learn more about it. So you talked a little bit about grant writing. I am curious, did the grant get funded? Is it still being reviewed? What did that look like for you?
Yeah, so when I wrote the grant, we wrote to the National Institute of Healthcare Management Foundation. And we started with a letter of inquiry. So previous to that, I had been wanting to write something like an RO3, kind of along those lines, with all that detail, because I knew I was going to be writing another proposal for the Department of Corrections, which is separate, to get approval for the project. So we ended up writing a letter of inquiry, and I feel like that was harder than writing the research proposal because you have to be very concise. You don't need to give them a whole laundry list of what you're doing. That is the opposite of what you want to do. You really need to say, this is a really cool project. This is all the things that it's going to do. These are all the people that we're going to reach. This is why you want to fund this project. And then eventually you'll get the proposal. And that feels like the easiest part. But I think that was a really good experience for me because I feel like if I can write a grant for the National Institute of Healthcare Management, I can write for anybody. So
That's
yeah.
exciting. It is often harder to be concise than to meet 2,000 words, or it's like, okay, now I have to bring that down to 150. I don't know how to do that. So that's
Yeah,
really good practice. That's excellent.
for sure.
That's great. So I think it seems pretty obvious based on what I've heard about your experience in these few minutes. But what aspects of your experience are you most excited and how it's going to contribute to public health?
I would say the educational resources are really exciting. I TA'd my first year of my grad program and I loved working with the students and kind of seeing what they were interested in and like how I could support them that way. And I think the educational resources for me are exciting, knowing that students are going to read them and to be able to ask those questions. So they'll read the policy brief. They might say, hey, this is really interesting about tuberculosis in correctional settings. I didn't know that there weren't a lot of prevention measures. And then when they can look at the resource list, they'd be like, wow, I didn't know the CDC did that. And then they can learn more about that field and see if that's something they're interested in. So that's something I'm really excited about. I would say for the grant proposal, pregnancy in prisons, like I said before, is pretty under-researched. There is a lot more information coming out now. But I think if not to just contribute to like the small body of literature out there, it can also contribute to the Department of Corrections saying, well, here's what people are saying. This is what your incarcerated women are saying. This is what your staff is saying. This is what your healthcare providers are saying. And, this is what you're doing well. This is what you're not doing well. How can we figure out how to improve that? I think that'll, if it's funded, that'll be really exciting.
So I love that I'm hearing so many different implications for your project. You have the public health implications of improvement for health services, access in prisons, preventative care. You have quality improvement because you have the Department of Corrections learning what they are and are not doing well from their constituents. And then you have workforce development. So not only is your work hopefully going to contribute in this direction, but you're saying, hey, come along with me, come here and do this work with me, which there's so much power in that because we need more people in the spaces that are under-resourced. And so I like that you sort of have these two big branches to your project, recruiting other people to do the work and then doing the work. That's really exciting. And I love workforce development. And I think, all of us in student affairs love workforce development. But I think that's really great to see that embedded into your project. So how do you think your internship experience is going to help you on your career path? Did it affirm your career path for you or change your direction?
I think I think the way my internship experience is going to help my career path is that it definitely affirmed it. It definitely said, I definitely looked at it and said, okay, this is something I'm really interested in doing. This is what I really hope to dedicate my career to. But I also know that there aren't that many opportunities in correctional health. So if I don't end up working in that right away, that's fine because again, grant writing policy briefs, being able to develop training materials, those are all transferable skills. And another thing that I really realized was that, when you're doing criminal justice health research, you have to learn how to read legal information. And public health kind of prepares you to be doing that because you're able to see, okay, well, these are the people who are going to be impacted the most by this policy, or these are the people who this policy is targeting. And then this is a goal of public health. This is really getting in our way. I could go on and on, but I was really happy to see that those skills are so transferable. So even if you have an MPH, you could probably go into a whole different field and you'd be completely fine. So that was pretty cool.
And I love, so something that you're doing that I think is a great thing to think about if for any of the students in the space who haven't done their internships, is you took aspects from your concentration, right? It's maternal child health focus. It really is looking at health for women and children in prison settings. But you were building skill sets in other areas, policy and management, leadership, right? So you really thought about strategically, what will make me marketable for my job? And it's not just, okay, it's not just that I'm going to be ready for correctional health because there maybe isn't a job for me yet, but I'm going to make sure I have these other skill sets so I am marketable as a future, employee in a variety of settings while I build myself in this direction. And I think that's a really smart thing that you did because I think it will help you on your next steps. And just that you're thinking about that, right? I think that's kind of one of the biggest pieces. So that's really great to hear that that's how that worked for you. So our next question is, a little bit more focused on what do you think skills and knowledge from your MPH curriculum you most utilized during your experience? Like, what did you feel like you brought to the table as like content expertise or skills from your MPH curriculum?
Oh, there's such a long list. There's so many classes that I feel like really prepared me for this internship. The first one was maternal child health epidemiology. I feel like with that class, what Dr. Pettygrove had us do was exposures and risk factors, temporal and spatial factors of disease. And when you're designing that study, you really have to be thinking about that information. So what are the questions they're going to be asking? What's the data we know to collect? And being able to look at the literature and say, okay, this is what this literature is saying. This is saying, okay, this is what we've been looking at. There might be a link here. We need to look more into that. Another class was biostatistics. I am no longer afraid of the methods section like I used to be when I first started reading it. And then I would say evaluating public health policy, evaluating public health literature or evaluating scientific literature, 609. It's mainly PhD students, but I really thought it was helpful because all we did was read articles and talk about them. And that really helped me feel more confident being able to interpret information and kind of be able to discuss it with other people if I didn't understand something. So that was pretty cool.
And that's truly a skill set for anyone in any career ever, because we're all going to read articles. We're all going to, hopefully want to improve ourselves in our profession. And so being able to do that is a real skill set. And did you meet your doctoral buds in that class, or did you know them already?
No, so Callie was actually my roommate my first year, and we still keep in touch. And then Sabrina, my faculty mentor, Dr. McGrath, I had told her what I was interested in researching, and she said, "Oh, I know somebody. Let me put you in touch with her." And then, yeah, from there.
Yeah, the power of sharing, telling people what you're interested in, it brings no harm, right? You get connections, you get those soft handoffs are really nice. So that's really great to hear. But you were able to really dig in a little bit. And I think sometimes students are a little bit nervous to take those mostly doctoral student classes because there's some intimidation, which is understandable. But learning how to do that and partnering with those folks, I think that was a good choice for you. And was that an elective for you?
It was. I needed just something to fill some space, and I'm really glad I took it. It was so nice though. All the doctoral students, they're so knowledgeable. Like, you have so much to learn from them. Like, one guy was like a TA in my biostats class, and I still asked him questions. I was like, "Hey, I don't get this. Can you explain this?" So no, it's great.
That's awesome.
They're so nice.
That's great to hear. So that was a good elective choice for those of you who may need some electives. It's a good experience.
It's 1 credit hour.
Yeah.
One
Do
day.
it. Yeah. So what would you say you felt like the biggest challenge from your experience, or were there challenges, and maybe what was the biggest challenge, whether it was like a skill set building, a task, a relationship, anything that sort of comes to mind that might have been a challenge, and how did you overcome it?
I would say at first, designing the study, because I feel as though it's kind of hard to design something when you don't really have a blueprint for it, when this hasn't really been researched before and no one's really kind of looked into it as deeply as you want to. I think so like, for example, questionnaires and like figuring out how you're going to get this information. Questionnaires that were designed to look at healthcare quality were not designed to look at prison care at all. So you have to deal with that reliability and validity of the study. Thank you, Dr. Pettygrove. If you're watching this. So that was definitely a struggle. Another problem I think I ran into was figuring out how to establish those learning objectives, or not really objectives in the sense that you can read this and you can do X, Y, and Z, but more like, you're looking at this is the information that I want you to have, and this is kind of what I want you to be able to dive into it if you're interested. I didn't want to just write a textbook. It was 4 pages. So that was also challenging, kind of being to the point, but also encouraging people to start thinking about it.
Yeah, I think sometimes challenges are often just around being innovative and creative, right?
Yeah.
And sometimes that comes from like, we just haven't done it. Some of our other classes are things like biostats. You're not necessarily being creative. You're learning a system and an approach. And so all of a sudden you enter this applied experience and somebody's like, "Tell us what you would do." And you're like, "I have no idea what I would do." But I
Yeah.
think you approach it in a really good way. Like, okay, let's break this down. What am I going to learn from this? How am I going to approach it? So that's
Yeah.
really great to hear. So I would like at this point to open it up to the audience. I have plenty more questions I can ask Isabel so we can learn more about her experience. But I'd love to open it up to anyone in the audience who has questions about more details about what she did or perspectives on the internship experience. So if anyone has questions, just raise your hand or use the chat. And I'll give space for that to happen. I'll ask you one question while we wait for people to maybe get their thoughts together and write it out. But what would you say was your favorite part of your experience?
I would say at the end where I saw everything that had come out of the internship. So submitting the LOI, having the policy brief done, and sorry, I lost my train of thought. Oh, and having that resource list with all the information on it, that made me feel really happy. It was just very accomplished, like kind of like a light weight was like lifted off my shoulders. That makes sense. So that was
Yeah,
exciting.
it does. It also sounds like in your conversations with your site, your preceptor, you really developed an experience that was going to allow you to do things you were excited about, which I think is, great advice for folks to take. Like really have a negotiation conversation about like, this is what I'm excited about. What do you need and how is it helpful for you so that you can work on things that are really exciting for you? We
Yeah.
have one question in the chat and then Dr. Kutshaw has a question. So the question in the chat, I'll just read it, but you can see it too. Do you believe that the inclusion of a specific class in your curriculum would have better prepared you for your experience or enhanced your performance? If so, what class or subject area would you have wanted to have incorporated and how do you think it would have benefited
That's a good question. I think a lot of the classes that I had taken really helped me develop like certain skills. I think the class that I would have been most interested in would have a correctional help component to it, because I feel like it's not really there's not really a lot of education surrounding that area, but it's actually a pretty important part of public health because 97% of those people get released into the community. I think it would have been good so I had some information in my back pocket and I didn't have to do hours and hours and hours and hours of reading to have a certain understanding. So I think it might have made my internship a little bit more efficient in that aspect. But I really think that there were the classes I had, they are what you make out of them. Sometimes I was sitting in class and I was thinking, I'm just tired, I want to go home. But I think if you really pay attention and you ask your professor questions, there's a lot you can get out of the classes.
I would also add too, certain classes when you're allowed to choose your research topic, if you have a particular content area of interest, choose that so that you can develop. I mean, and that takes forethought and also having a particular content area of interest to develop. But there are sometimes areas in the curriculum for that. Dr. Kutshaw, you had a question and then we'll pop back to the chat.
Yeah, so first, Kim, great questions. I'm learning so much, and Isabel, really great work. What an exciting internship you've done. My question is, I know you mentioned a letter of intent and working on a grant proposal, and that's not something a lot of our students get exposure to. Can you say a little bit maybe about what helped you in thinking about how to write that letter of intent? Did you look at grants? Examples? Can you talk a little bit about that?
Yeah, I think the best part of learning to write that was being able to look at those grants and read what somebody else had done. I'd also written the letter of intent previously about a year ago with another colleague, and going back at that and looking at all the mistakes that we made, she literally looked at it and she was like, no wonder we didn't get funded. Again, like what my preceptor also told me is that a lot of the time when you write a grant, you're not going to get it. You're going to win less than you're going to lose more than you win. And just being able to learn from your mistakes and being okay with that was really important. I would also say really looking at other methods and papers and seeing, okay, this is what funded studies do, was also really helpful. Does that answer your question?
Yeah, that's great. Thank you.
Thank you.
Yeah, grant writing is one of those skills that I think everybody should have. I don't have it. Everybody should have it but it's sometimes hard to get it because it's a challenging, I think, to learn. But it's great that you had exposure to mistakes and hindsight, and you'll be able to carry that with you into all of the next phases too. Which brings us to Sheena's question. So she says, are there any follow-through items that you hope to take with you into new opportunities or grow on your own for additional research?
That's a really great question. I would say definitely the proposal on prenatal care. If it gets funded, I would really want to expand that just after that first initial project, because at first I wanted to study, how effective was the prenatal care, but you really can't do that until you know what that prenatal care is, or like what's going on. Are women getting 7 visits? Are they getting 10? What tests are being run? I would say again, like the grant writing is important. And I hope to pursue a PhD in epidemiology and become like a professor and teach other students and do research. So I would say being able to develop educational materials in a public health standpoint, that was really exciting and something I really think that I can take into my new career as well. Hopefully that answers your question. No, it's a really good question. So I just had like so many things to say about it. So.
You're just about to graduate too. So you're thinking, okay, what am I going to use next? We got to figure out what that next step is, right? But that's great to hear interest in the PhD. And I love that you're already thinking about, okay, how would I bring this to future students? And I think that's such a great thing to bring with you. Not only are you interested in the research, but how do you teach people about this topic and ways that are impactful? That's great to hear.
Yeah.
So again, anyone else, feel free to raise your hand. Chat functions work great. So we've heard a little bit about how you networked to find your internship, but during your experience, did you find that you had other opportunities to network in the field or with other professionals, and sort of what was that like for you?
So because of my internship, it was remote. So I didn't really work in like an office setting or in a community setting, but what I did think was important was looking at those organizations that work in correctional health or have even just some piece of it. So for example, the Sentencing Project, they do a lot of journalism to call attention to correctional health issues. The American Civil Liberties Union, everyone thinks it's like this big legal body, and it is, but they also do malpractice suits when there's been medical negligence in prisons. They do policy, they influence policy, and just knowing those are organizations that I could partner with or even look at for careers was really important. And that's actually part of the reason we incorporated that into the internship, was because my preceptor wanted me to know what opportunities were out there. And again, you had to get creative. Journalism and public health aren't that related, but it was a really good experience.
I always say things are, 6 degrees of Kevin Bacon, 6 degrees of public health. We can connect anything to public health in less than 6 degrees for sure.
Yes.
Even when it doesn't seem that way, right? Journalism, it's there, it's embedded, right? Correctional health, we know that. So it's good to hear that you did that. So I want to go back. So you said your experience was remote, which I think more and more experiences are these days, both for our online students, our global students, but even for our campus-based students, because your interests go beyond the physical campus where you are. So what do you think were some pluses and minuses of doing a remote experience from your perspective?
I would say pluses that I could work it around my schedule. So as you know, I'm a graduate assistant, and just having that, say I work from like 6 to 2, I have the whole afternoon to be able to work on that. When if I had to be in an agency, maybe I had to be there in the morning, and that would have been really hard to balance. And, grad students have to work in school. It's stressful, but we have to. I think like the minus though is not really being able to make other connections with other faculty at NAU, which, it is what it is. Or being able to work with other people. I really do like working in a team setting because I can bounce ideas off of each other. So yeah, I think those are.
Yeah, I would say that the minuses are things that we typically hear about remote work from, especially when you're the remote person and other people aren't. I think that's sometimes where it's hard. If everybody's remote, you normally have a system developed to be remote. And so there's definitely that learning piece. And, you know, the water cooler conversations don't happen the same way. You have to be more proactive. So I was happy to hear that you built in some of those proactive things into your experience of building connections with the ACLU, with other organizations, because I think it's important to be active, proactive in that way, as opposed to, you know, you get to the end of your experience and you're like, oh shoot, I didn't do that. Build in moments of forced connection. You have to connect with these people, because sometimes that's how it has to happen, and it has to be scheduled, and that's okay. It's different and it looks different. But to your point about flexibility, I think that's one thing we see lots of students need. They just can't be in an office setting 8 to 5. And so I'm happy to hear that you were able to create an experience that allowed you to, you know, pursue your degree and get what you needed while still having a great experience. It's really great. So what is a piece of advice or pieces of advice that you would give to fellow MPH students who are in the planning stages of their internship?
I would say definitely, there's so many things I can think of I wish I had done.
We have time. You can give this question as much time as you'd like.
I would say the first thing is make sure you read your handbook. And if you have questions about it, just send a quick email. They're not going to get mad and be like, well, it's on this page, you should have read this. No, it's like sometimes I'll read right over it and I just won't even register that it's there. So they were really helpful about, you know, being able to say, okay, this is what you need to do. I would also say like find somebody like an agent, I guess your agency, your mentor, whoever you want to work with, and start talking to them and just seeing, okay, well, what is it your agency needs? Like what, how can this benefit me? And I would also say, like, look for somebody who isn't just gonna be like, well, she's an intern, she's doing this, I'm gonna let her do her thing. Like find somebody who's gonna be like engaged with you and really like able to help guide you. Like, yeah, we're all adults, but we're kind of public health babies, if that makes sense. So we kind of need sometimes we need someone to hold our hand. We just do. Because then eventually you're not going to need, you know, someone to help guide you anymore. But the point is you're going to need that guidance now. And I was really lucky in that aspect. And then I would say, don't be afraid to try, like, if you know, like, oh, I might have to write a grant or I might have to do statistical analysis. Don't do anything you know you cannot do for this, but don't be afraid to push yourself past your comfort zone. So like going through the pain of doing statistical analysis when you've never even used stats before, you've never even used a code before, I don't recommend that. But if you're like, okay, I kind of know Stata, I have done this in biostats a couple times, you know, we're going through it right now in my epi class, do it. You know, like the point of your internship too is to be able to do those things and push yourself outside that comfort zone. Or maybe I just majored in chemistry and like coaching myself, but you know, it is what it is. But I think that's my advice.
Yeah, I would say hearing that, I think it's like when you are you know, what is the appropriate challenge? So it's not you are setting unrealistic goals for yourself, but you are appropriately challenging yourself to learn and practice skills. I would also say I've seen students who do internships and they design internships, and if they know they need biostats, and that's usually the piece that comes to mind, they should also be at the same time fostering relationships with people who can help them with that. So if that's not your preceptor, maybe you need another mentor. Maybe you need another relationship with a faculty member, or developing a relationship with a student, somebody who might be able to coach you or help you a little bit more on that, because you will need it. And we can't put all the weight on the preceptor to do it, but we do want that to be a strong mentor relationship. So yes, appropriately challenge yourself to step outside maybe your comfort zone, but knowing what you can provide and be able to give an excellent product deliverable to the agency, I think is really important. So I think that's really great advice. So would you have done anything differently from the setup of your internship? And I know that's a really big question, right? The hindsight 2020, when you are just like weeks away from graduating, might not have settled in yet. But would you have done anything differently that you can think of at this point?
I would say I probably would have tried to see if there were any opportunities in the affirmative corrections. I didn't find out they had internships until I started looking for jobs. And I still would have done the internship at NAU, but part of me wonders if there was a way, because they already have a relationship with the prisons and jails in that area. would there have been a way for, as part of that internship, for me to work with that entity? But I wouldn't have changed my internship at NAU. I think I learned a lot. I'm really glad I did it. But I think that was like, just to have more of a community component, that would have been something I would have wanted to incorporate. But again, that was coming off of the pandemic, and the situation in prisons and jails wasn't good. So it might have been kind of complicated. Even if you don't set foot in there, there's admin stuff that really, might have been an issue.
Yeah, I would say the level of approvals to get that might have been overwhelming in your graduation timeline. But in the grand scheme of things, like we tell students, there's internship for credit and then there's internship not for credit. So some students do both, right? They design an internship just like you did, but they also might intern over a summer where it's not for credit, it's just experiential. And so if those opportunities exist for you, or you find them, even if they're later, you can do those. You can do those too. But I know you're at the next stage where you're like, okay, I'm looking for that paid job. So what are we going to do next? But it's good to hear that you did learn about that. If there's opportunities that you hear about that sounds like you want some students to join the correctional health world, let us know and we'll share them. We don't often hear from them, but we're happy to share them and get some folks onto your side of the block there.
For sure.
Any questions from the audience? I'll make sure to pause here and see if any folks have questions still. Okay, so please feel free to do so as I ask the next question. So what is some parting advice that you would give to either current MPH students or prospective students about internships as a whole that maybe you haven't already shared, because you have shared some good tidbits along the way today? But is there any like parting experience you would want if they remember one thing from your talk today? What would it be?
Oh, that's a good one. I use that all the time.
Right, you gotta seal the deal.
I would say think about how it's going to set you up for your future career. Or if you don't know what that is yet, that's okay. Think about, I would even do some market research and say, okay, well, these are some skills you need in public health. This is, maybe we're all into coding now, or, in a few years, who knows what it'll be. But I would definitely figure out what skills or what experience you want that's going to set you up for that next job that you want. So
you were speaking my language today. That is the exact homework assignment I give it to any student who wants to do career development. I say, go find five job descriptions of jobs you want in the next 2, 3, 4, 5 years, and develop a list of skills from those job descriptions, and then figure out how you're going to get them. Is it going to be from a class? Is it going to be from an internship? Is it going to be on your own or from a Google certificate or some other way? Figure out how you're going to get those things so that you are the most marketable candidate when your resume speaks to those jobs. And look at different things. And I think you did a really good job of that with bringing in the policy side of things, the grant writing side of things, because those skills are not content specific. You can use those skills, it's a beautiful thing, in any content, public health or not, in any aspect of like the world. And so I think that was you use your own advice ahead of time, which is great. Did somebody give you that advice along the way, or had you sort of just developed that?
I think I've heard bits and pieces from different people throughout, undergrad and grad school. And then it just kind of finally clicked in my brain, and I was like, oh, this is what they were telling me. So I would say that. Yeah.
Yeah, that's awesome. I'm glad. And now you are imparting it to other people, and we can share it widely beyond conversations we're having with students, that it's coming from you, who's like, not us, right? I think it's a better situation. So that's great. So that was all the prepared questions we had for you today. Is there anything else you want to share with us about your experience, or parting information you want us to know about internships in general?
Oh gosh. Sorry.
Big bang question for you right at the end.
Oh, no, you're good. I think what I would want students to know about internships in general is that, oh gosh, it's just it's not something that you really need to worry about, like passing or failing, or like, not making a mistake on or whatever. It's really see you go and develop those skills. And it's really supposed to be a learning experience. If it's not perfect, it's okay. You know, you can make it perfect. But you don't have to worry about, I think, don't worry about like being unsuccessful or whatever, because I think the goal is to just be able to learn and learn from your mistakes. So that would be what I say.
But it's not about perfection, it's about process and progress and achieving some goals therein. I like that. Isn't that the fancy way of saying like it's not the destination, it's the journey?
Yeah.
Is that like the catch
Yeah.
the catchphrase there?
Yeah.
Yeah. That's really important though, as silly as we can make it. I think it's really important for students to see the internship as a part of their journey in this MPH. And it's not about having the perfect thing or the perfect end result. Some of us, myself included, had internship experiences that absolutely taught us that that was not the field we were going to work in. Mine did not affirm my pathway. Mine said, this is not your gig. And that's a very valid experience. And lots of students have those. But I'm glad I did it, right? Because I wouldn't have wanted to work in that field. And so if I hadn't done an internship, I might have ended up in a job that would have not been a good fit for me. And so did I still work really hard to do a good internship? Yeah. It was never going to be perfect. And it wasn't going to be part of my journey in the long run. So I think that both ways are great. Like you have said, yes, I'm working in correctional health. Whenever I can find that good job, that's mine. And you set yourself up for that. And I think that that's a really powerful thing. So I'm going to leave it open here for just a couple minutes. If anyone has a final question they want to ask Isabel or anything that they want to impart to the group, we'll have time for that. But otherwise, we'll probably end a little bit early today. Once we're done with Q&A, though, I am going to pass it off to Samantha and then Mariah for a little bit more information about what presentation viewing for the rest of the conference is like. So this is like our virtual kickoff event, and then we'll have a little bit more information. So anything else anyone has, questions they have for Isabel today? Well, we are so thankful, Isabel. I was very excited to learn about your project. I am so excited to watch your full presentation. I don't watch them before because I want to learn from it fresh because it's a little more exciting for me that way. But I'm going to go watch the presentation because the correctional health, prenatal care and correctional health is fascinating. So yeah, big applauses, whether virtual or real, for Isabel today. Thank you so much for imparting your information. And so at this point, I will, yes, you're welcome. No, thank you. This is about you. I'm going to pass it to Samantha for a little bit more information.
Hey everyone, thank you so much for attending today's internship student highlight event. As Kim mentioned, this is our kickoff event. I will discuss a little bit about the conference itself, and then I'll pass it on to Mariah to chat a little bit about the internship website and where you can view all of the different presentations. So again, thank you everyone for attending today. And of course, thank you, Kim and Isabel, for this great discussion. I know I learned a lot and I'm super excited to see all of the rest of the presentations that follow suit with our Summer 23 internship conference. First, we would like to thank all of our wonderful sites throughout the state, nation, and world with whom we work to improve the state of public health. This conference serves as a professional opportunity for our Master of Public Health students to share their applied practice experiences and has been one of the most impactful and practical components of our program's curriculum. Through contributions they have made and the benefits they have gained, this conference reflects the undeniable handprint of MESCOP students on public health projects and agencies throughout the world. We sincerely thank you for joining our virtual MPH Applied Practice Experience Student Highlight event. And for those viewing this recording, hi, and thank you for watching. There is a link to a feedback form for this live event in the chat. I'll post it here in a second, or thank you, Kim. And we would appreciate if you could take a few moments to complete the form. And this just helps us better make this event better every single time. We do host this event semesterly, so we do appreciate your feedback. It doesn't take very long, tops about 5 minutes. With that, I'm going to pass it over to Mariah, who will go into more details about the website and where you can view the other Summer 23 presentations.
Yes, so this virtual experience allows us to provide a conference that showcases projects from students across all of our campuses, so Phoenix, Tucson, and online. Each student has recorded themselves presenting on their applied experience. These presentation recordings are being hosted on a webpage on the College of Public Health website. This webpage went live earlier today, and you can now access our Summer 2023 presenters presentation recordings. And Kim just put the link in the chat. We have also set this website link to our College of Public Health community, as well as individually to all presenters for them to share with family, friends, site preceptors, and anyone else they would like to share it with. Presentations will be viewable in an on-demand format as of Monday, July 17th until the end of day on Friday, August 4th. At that time, the presentation viewing webpage will be deactivated. We encourage you to watch as many presentations as you are able to during the viewing period. For each presentation you watch, we also ask that you fill out the presentation feedback form that Kim had posted. We appreciate your support of the College of Public Health and our MPH students. They've all worked incredibly hard on their projects, and we are excited for you to view their presentations in order to see the ways in which they are helping move public health issues forward in our communities. We have now come to the end of our live event. We sincerely appreciate you all joining us this afternoon, and thank you to our student speaker. And we hope you enjoy watching the student presentations and have a fantastic rest of your day.